for the topic of diabetes, often has come up with patients from a diagnosis perspective, but also then the treatment and what that means lifestyle wise. What would your opinion or comment be towards patients coming in for those initial discussions regarding diabetes and what their management and treatment plan might be?
Management and treatment plan of diabetes is always critical early on. You want to clearly make lifestyle changes. What may have triggered this? Obviously, there's a genetic component that may be a factor, but often there's a lifestyle component, whether it's inactivity, whether it's increased caloric intake, the type of caloric intake that a person gets. Many different routes can be started. Often we start with something simple, low dose oral medications. We try to then follow this along on an every 3-month sort of blood test to manage and see whether we're getting good control or not. Some cases, the weekly injectable medications, often known as GLPs or GIPs, can help with this process. The latter, though, is often expensive. It's difficult to access, even through public and private plans. There's often criteria associated that you have to have established a lack of control despite the effort with multiple oral medications. I think that it's helpful overall if you can get on it. I'm not against anybody doing it privately and just paying out of pocket for the drug. But I have to admit that they're probably costly and can be difficult to manage on your own without appropriate supervision.
Are there pros and cons of oral versus injectable in the treatment or management of your diabetes? Like, does one have more side effects than the other?
Again, it depends on which oral medication, which injectable you are using. I think the question's a fair one, but the broad range or the broad group of medications that you could or couldn't use all have their different pros and cons to which you can use. Some of the early medications don't create lows. Some of them do create lows, and you want to be careful with that because you never want to have a low blood sugar when you are managing this. Some of them are effective with certain types of people, but not effective with other types of people. Some of them have an ease of use in the fact that you don't have to take them daily. Some of them you do have to take daily or even multiple times per day. All of these are factors and discussions and decisions you should make with somebody experienced in diabetes management.
And a final takeaway for patients regarding diabetes, you said that they may not always be on those medications. So if there's a takeaway point that someone can take out of it between their medications and a diagnosis, what would you have to say?
I think, again, routine follow-up is the key here. Managing appropriate testing, and then having honest discussion with the healthcare provider that's following you, managing this diagnosis is the critical portion of it. If you're doing so, then you can make changes. You can be encouraged to lead a healthier lifestyle and thus have less issues related to a diagnosis of diabetes, whether it's eyes or heart or skin or sensation. All of these things may have a negative effect for diabetes because diabetes can be a very tough disease. You will be a healthier person if you have constant contact with somebody to help you manage that.